Thank you very much, and good morning, colleagues. Yes, thank you very much also for the opportunity to present here. As you can see, the topic I'll be presenting, as you've already alluded, is how do basic sciences like botany contribute to human health? So mainly here, it's about basic sciences, and as you've already heard, basic sciences is not necessarily meaning simple sciences, but fundamental sciences, how these could actually contribute to human health. So I'm just going to maybe start with an analogy to just make a point here. Let me just see something, if this is, all right, let me just see. Yes, you can see, basically, if you see here a plant, you've got a stem here, you've got the leaves, and so forth. In some cases, you might also have maybe fruits coming out of this particular plant. But you'll see that basically the stems carries, underpins everything that actually happens here. So the same thing actually applies to basic science. In this particular case, I'll be concentrating on plants as to how they actually contribute towards human health. Very much important, because everyone these days is concerned about health. And you'll see that when we're talking about health, really, when you're asking people, especially about the role of plants in health, or just maybe plants, studying plants, most people are not really interested in the study of plants. If you look at other universities, even overseas, you'll actually see that there's also a decline in students maybe taking subjects like botany and all that, because maybe they're thinking that it's not really cool. In fact, there was another survey that was done. In this particular survey, people were asked whether, plants would actually be part of wildlife. Thus, plants actually form part of wildlife. And many people, I think 30% said no, because you can see that many people do not know much about plants and all that. And even at university level, students really do not see that much any need for them maybe to start subjects or to study subjects like botany and other. But as we're saying, botany is none other than the study of plants, the study of plants. And of course, as you know, plants actually form, I think, something like 80% of our biomass, yet populations around the world really know very little about plants. And we also are losing talent in this field of plants, because some people are getting old in this particular field, and because there's no appetite in plants. So we lacking people who can also maybe go deeper into research, into the value of plants as you move forward. But here I'm just going to really touch on some of the aspects of plant as to how they can assist all of us, especially around maybe improving our health. Now, this is just maybe some of the things I will start with, the very obvious things that you know about plants, the uses of plants and all that. I think we are all aware that they produce oxygen and you maintain your soil quality and provide food and habitats to other organisms. So mainly here for the sustainability of humankind, I think we need oxygen. So plants actually play an important role in producing oxygen, and of course reducing even your pollution, because they can actually capture your carbon dioxide from the atmosphere, and we are well aware of that. And this is the fundamental what plants actually do here. And of course, most importantly, also plants can be beautiful, and they are very much embedded in cultures worldwide. People, talk about plants. If you look at the different cultures, plants are part of these cultures worldwide. But most importantly, also, if we're talking about plants, you will realize that some people even today talk about what you call the parenting of plants, where people would maybe look at a plant, look at that particular plant as it actually grows. And this is also very much important for their mental health, for maybe also making sure that, if you've got stress, to deal with your stress. So there are benefits for others who are actually in this thing of parenting, or what we call plant parenting, where you grow in your own plants, this can actually relieve stress in you and contribute to your good, mental health. And that's why some people are actually involved in plants, want to grow plants, have their own gardens and so forth, because really this is basically refreshing. And that's why we're saying that really plants can really contribute to making sure that we're living a very good and productive lives. Now, but getting to the gist of it, of plants, really, when we're talking about plants and health, you'll realize that in many cases, plants are also being adapted in new ways to substitute for meat and dairy. There's this whole thing that is happening in this day and age where many people are trying to move away from dairy. Some are trying to move away from meat because maybe of the effects of some of these foods. And we all know that if you maybe are suffering maybe from hypertension, diabetes and all that, that if you really eat a lot of plant-based food, that can alleviate or lessen the symptoms or even make you better when you introduce more of plant-based food. And research has actually proven that. Also, maybe to prevent one from getting some of these conditions like your diabetes, your hypertension, if you eat lots of plant-based food, then you can prevent yourself from contracting some of these conditions and all that. And that's why many people are moving away from maybe this meat and dairy. And now today you've got substitutes of dairy where you're looking at milk that is basically plant-based and so forth and so forth. And even today you can also have a burger party that is basically made of plants and all that, because of this new move of many people really trying to move away from meat and dairy products. And the jury's out there, because maybe we can hear debate as to whether meat is good or dairy product is not good or something, but this is not the gist of this kind of discussion. But as I said, really science has also shown that if you really introduce lots of plant-based food in your diet, then you'll feel better. And of course, you can prevent yourself from contracting some of these conditions that people are facing, especially in this day and age. And of course, in our laboratory here, we basically are looking at that. We're looking at the benefits also of maybe the kind of things that we can derive from plants, even maybe some compounds that can be derived from plants that can be used then as drugs later, that can be worked or used as novel compounds that ultimately can be drugs that can be used against many of these conditions, including even your cancers and all that people are actually struggling with in this day and age. But now, most importantly, also the plants are now programmed as molecular factories. We've got an example of plants that are involved in the production of the monoclonal antibodies that compose the ZMapp Ebola vaccines, and then also in the development of a prospective vaccine for SARS-CoV-2. Now, you know that I think it was in 2020 or to 2021 where there was a group of people who are basically working on developing the SARS-CoV-2 vaccine using plants. So you can see really the importance of plant in making sure that it improves the health of the population. Of course, and we're saying that therefore the beneficial uses of plants are actually limited only by the available knowledge, the scientific resources that we have, and also our imagination. And therefore, that's why we're trying to also encourage many people to learn about plants, the value of plants, and making sure that really, if we understand plants, then we can be able to come up with solutions, and making sure that we're working towards sustainable development by making sure that we're using also plants, as I'm going to also a little bit later show how that can be done as we move forward as a society. But now, my talk this morning is basically or I'm concentrating mainly on using these particular plants maybe as, agents for novel compounds, for new drugs that people can use against many ailments. But as I already indicated, it's not necessarily just to come up with new drugs, but to making sure that really we're using this plant to protect ourselves from contracting some of these chronic conditions that are really wreaking havoc in society in this day and age. And also, that basically if you're eating a lot of plant, you can also maybe deal with a situation of obesity that we see also in developed countries where many people really concentrate on fast food and all that. Then there's a huge increase in obese people, and this leads to your hypertension, diabetes, and so forth and so forth. And of course, if people were conscious about the value of plants, so some of these things would not really happen in their lives. But as I'm saying, at this particular point, then I'm concentrating really on how these plants then can be used as to improve the health of the population, or to be used as drugs. Now, you will notice that if you're looking at the pharmaceutical companies today, they're mostly interested in single ingredient drugs, meaning that basically, let's say you've got a particular plant, there are quite a number of ingredients, what we call a crude extract. You're extracting something from plant, a crude extract, maybe you can even test that and see that that actually works. Because in our labs, we also do that. We've got what we call a crude extract, but also making sure that, again, we go through that route of single ingredient drugs, because this is very much important, where you can be able to standardize that and be able to look at the concentration. Because in some cases, let's say you're just using a crude extract from a plant from somewhere. Let's say you're getting it from Bloemfontein, you're getting it from Durban and all that. There's quite a number of factors that can influence the concentration and the efficacy of that particular maybe extract, because it has not been standardized. The concentration might differ from one region to another, and so forth and so forth. And that's why maybe also your pharmaceutical companies and so forth would actually be interested in this line of single ingredient drugs. And that's why we're saying that many blockbuster drugs are derived directly or indirectly from plants. And here we've got quite a list of drugs for cancer, drugs for hypertension, for diabetes, and so forth. Many of these drugs have been derived from plants, and we can go on with the list of these kinds of drugs that have been derived from plants. And many of you might actually know them, these kind of drugs that have been derived from plants. And many people might not even be aware that really the drugs that have been used today have been derived from plants. We've got things like maybe your atropine that is being used for as an anticholinergic drug. You've got things like codeine from the opioid alkaloid, you see, that is being used as an analgesic, and so forth and so forth. So we've got quite a number of these drugs that have been actually developed from plants, and many people might not actually be aware of the fact that many drugs have been derived from plants. And therefore, as I'm saying, it's important, like if you're looking at aspirin, how many knew that that has been derived from plant? Actually, from acetyl salicylic acid, that ultimately was from this tree bark, the willow bark, and ultimately people came up with this aspirin. So you can see now the effects of plants in making sure that it improves our health. Now, but as time went on, the emphasis gradually shifted from extracting medicinal compounds from plants to making these compounds or their analogs synthetically. That's where maybe your chemistry then comes in, where people then would use the natural products as templates for structure optimization programs designed to make perfect new drugs. And this way, maybe the world is trying to move towards to say, let's now use these plants as templates and now use your chemistry to now come up with these drugs, synthetic drugs that would mimic, the structure of this particular natural compounds that are being derived from plants. And this is one way, basically, in the pharmaceutical industry, where now you need to go through that whole process and you test that, and ultimately to making sure that that particular drug actually works. But in most cases, we find that these drugs, some of them would have some side effects, as we are well aware of that. Quite a number of side effects when you're taking some of these kind of drugs, especially cancer drugs. If you're looking at what we are also doing in my university, is coming up with these drugs that are plant-based, that would actually be less toxic or less cytotoxic, because some of these drugs that you're taking, especially for cancer, then you lose your hair and other things that could actually happen when you're taking some of these drugs. And in most cases, the world has come to realize also that you cannot really maybe come to treat very complex condition or ailments using maybe a single ingredient drug, because these are complex conditions, and using a single ingredient drug might not be the ideal way to deal with that kind of a situation as we move forward. And therefore, the importance also of what you call the botanical drugs, that are drugs that are derived really from plants, where we don't actually maybe use a single ingredient drug, but we're deriving, maybe we just use a crude extract from those plants and use that to treat certain condition. You start the whole process by maybe testing the safety of these particular drugs, and maybe using in vitro techniques where you've got to look at maybe the different cell lines, even the normal cell lines, and check whether these particular maybe extracts would have a negative effect or will be cytotoxic to normal cells, because they need to just maybe target those maybe cancerous cells and not have a negative effect on the normal cells. And this is the work that we've also done in this case, where we've identified quite a number of compounds, and we're working also with pharmaceutical companies to get these products in the mainstream, to making sure that they can be able to assist quite a number of people. And as I've already indicated, when you're looking at these pharmaceutical companies, they will look at what you call the novel chemical entity, NCE, the novel chemical entity, and they're using that trying to treat complex disease with a single golden molecular bullet. In some cases, that does not actually work, and it creates some other challenges and so forth. And that's why the need also for botanical drugs that we are talking about. And of course, mutually potentiating effect of different compounds of complex medicinal mixtures is very much important, because we find that in most cases, what we deriving from plants is not maybe that particular active ingredient alone, but it's a combination of that with other ingredients in there that make that actually work better, you see. And of course, you might have seen that also in some cases. People now these days would take maybe vitamins, you take a lot of vitamins, and in some cases when you're taking these vitamins, you end up not feeling well by taking these vitamins. In most cases, your system will just flush it out because maybe you don't need this vitamin, but it's a huge industry. But in most cases, when you're taking these vitamins, maybe from plants and all that, because it's not just that particular vitamin, but it's also other ingredients that are basically in there, then you don't have those side effects that you actually feel when you just go in and take a particular vitamin that has been purified, a single ingredient, that particular vitamin, and therefore you don't actually feel better, as opposed to taking maybe something maybe from plants that has not been, or a crude extract from plants, where you've got a synergy of a number of compounds that would work together to deal with maybe the condition that you might actually be facing. And these are some of the different trends that we are basically looking at. But as I'm saying, most of these pharmaceutical companies would then really go the way of single ingredient drugs, as we're saying, that is not an ideal situation, looking at basically the complex diseases that we are facing in this day and age. So to just also look at that, I think also today I've mentioned the COVID-19 vaccine, and that some people are working on that to develop the one from plants. But you also know that the COVID-19 vaccine is not bulletproof, because people thought that giving this particular vaccine, you're not going to get the virus and all that, you're not going to infect other people, whatever. But it's the opposite. I mean, people who have been vaccinated, double boosted, triple boosted, they also get COVID-19 and all that. So you can see that the vaccine itself is not a silver bullet. So that's why we've also looked at the botanical drugs. What drugs can we actually come up with to really make sure that we also deal with this a pandemic? And in this particular case, we've done also some work where we have actually looked at some of the plants, and some of them looking at the COVID-19 virus. They've actually inhibited 97% of that, and they were safe, meaning that when you're looking in vitro, you're looking at your different cell lines, the normal cell, human cell lines, did not have any negative effect, but they were targeting only those the virus, but not having a deleterious effect on the normal human cells. And we also are taking this forward to say that really we cannot just look at the vaccine, but there could be some alternative medication that one can can actually use to deal with this a pandemic, or maybe if one has got symptoms of this particular virus as we go forward. So this is the kind of work that we are doing, and we also are involving some other companies and people to fund us to get this also to market, because we've already established in the lab that this can actually work. And you'll find that in most cases, when you go in the route of botanical drugs, because some of these have been used, or maybe these plants have been used for many, many years. So you don't even have to go through the whole process of also maybe going through the clinical trials, because if you're proving that that particular drug is safe, and the fact that, I mean, that particular plant is safe, and the fact that it has been used for many years, so it's easy then to be able to market that as alternative medicine that people can actually use to deal with some of the conditions that we're actually facing. And this is what we are basically working on, and we've been successful in actually doing in our laboratory, together with some pharmaceutical companies, and making sure that we show that plants can actually assist in improving our lives. But now, to conclude here, you will see that, as we've said, plants are by far the most abundant and cost-effective renewable resource, and it's basically uniquely adapted to complex biochemical synthesis, you see. And you can go the route of maybe trying to separate a particular maybe active ingredient, or maybe use a crude extract, because there's a synergy of quite a number of compounds that work together to making sure that these plants then have an effect without causing maybe those serious side effects. We know that anything would have some serious effect. Even if you drink quite a lot of water, there's bound to be some side effect of that. So we're checking all these kind of things, at what concentration these things can be used, to making sure that you don't actually develop maybe some very serious side effects. And we've got all these kind of tests in-house to test all these things. Now, the increasing cost of energy and chemical raw materials, combined with the environmental concerns associated with conventional pharmaceutical manufacturing, will therefore make plants even more compatible in the future. And of course, then farmers that adapt to growing crops for health rather than calories will profit from greater margins and higher values enjoyed by the health industry. And as a result, the planet could become greener and healthier. And there's also a view from people out there, as you know, that if something is from plants, is bound to be healthy and not causing side effects. But you know, as well as we know, that some plants have been shown to to cause some side effects, you see, and that's why it's important to test these plants. And that's why we also come in as scientists where we testing the safety of these plants, because some of them would cause maybe some liver damage. We're not sure of that. We just maybe say, oh, it's derived from plants. This is not going to cause any damage, but some have been proven to cause some damage. And therefore it's important for some testing to be done. But all in all, as I'm saying, really by introducing lots of plant-based diet and so forth, many people have been able to improve their health. And that's where plants actually come in. And that's why also society needs to be educated about the value of plants going forward, that really, if we study plants, there's no limit as to what plants can provide us with. In fact, some people have gone to an extent of saying, let plants be your medicine. If you eat very well and so forth, you can prevent some of these chronic ailments from actually occurring. So in a nutshell, this is basically what we do in as far as making sure that really we again educate people. We get students to also understand that really by studying also plants, there's quite a lot that these can actually offer to human health, and making sure that we also speak to the SDGs. Thank you very much. Thank you very much.
There's a question in the chat from Patience Mpumbude. Does ethnobotany, as it is, still have a place in human health in the future, without it being necessarily associated, stigmatized with, or as African traditional healing?
Yes, I think it has got a future, but we need to educate people. Like at one point I was actually saying also, you find that at medical school, they never even veer into talking about traditional medicine and all that. They would actually maybe just look at other Western medicine and all that, and forgetting the fact that the traditional medicine or your ethnobotany can actually assist us in dealing with some of the ailments. But obviously, this needs to be tested accordingly and validated accordingly so that they can also be part of the mainstream for treatment of some of these conditions. I think if you look at China and all that, you'll find that some of the medication, the traditional, if you go to the doctor, they'll also prescribe some of these things. And I think this is the direction that we need to take as a country, to make sure that we validate them accordingly, and therefore they can actually be part of the alternative way of treating some of these conditions as we move forward. Thank you very much.